Pregnancy is one of the most beautiful and life-changing experiences a person can go through, but it can also be a time filled with questions, uncertainties, and plenty of advice from well-meaning friends, family, and even strangers. Unfortunately, not all advice or information is accurate. Many myths surround pregnancy, and it's essential to separate fact from fiction. Let's talk about some common pregnancy myths and uncover the truth behind them. One of the most popular myths about pregnancy is that you have to eat for two. This saying has been passed down for generations, leading many expecting mothers to believe they need to double their food intake. However, the truth is that while you do need more nutrients during pregnancy, it doesn't mean you need to eat twice as much. In fact, consuming too many calories can lead to unnecessary weight gain, which can be harmful to both the mother and the baby. Doctors recommend focusing on eating a balanced diet rich in vitamins and minerals rather than simply eating more. A small increase in calories, especially in the second and third trimesters, is all that is needed. It's better to think about quality over quantity. Incorporating foods rich in iron, folic acid, calcium, and protein is more beneficial for both mother and baby. Another common myth is that morning sickness only happens in the morning. Despite its name, morning sickness can strike at any time of the day or night. For some women, it's a mild inconvenience, while for others, it can be quite severe. The exact cause of morning sickness isn't fully understood, but it's believed to be linked to the hormonal changes that occur during pregnancy. Thankfully, there are ways to manage it, such as eating small meals throughout the day, avoiding strong smells, and staying hydrated. Ginger tea or ginger candies can sometimes help soothe nausea. If morning sickness becomes too severe, it's always a good idea to consult a doctor. Severe cases might require medication or additional support. You might have also heard the myth that carrying a baby high means you're having a girl, while carrying low means it's a boy. This myth has no scientific basis. The way a woman carries during pregnancy depends on several factors, such as her body type, muscle tone, and the position of the baby. It's fun to guess the baby's gender, but the only reliable way to determine it is through medical tests like an ultrasound. Some people also believe that cravings can predict gender, but again, there's no evidence to support this. A particularly alarming myth is that pregnant women should avoid exercise. Some believe that physical activity could harm the baby or lead to complications. On the contrary, regular exercise is highly beneficial during pregnancy. It helps improve mood, reduce back pain, and prepare the body for labor. Activities like walking, swimming, and prenatal yoga are excellent choices. Exercise can also improve sleep and reduce the risk of gestational diabetes. Of course, it's crucial to consult a healthcare provider before starting any exercise routine to ensure it's safe for your specific situation. Tailoring your workouts to your comfort level is important. Another widespread myth is that pregnant women should not drink coffee. While it's true that excessive caffeine intake is not recommended, moderate consumption is generally considered safe. Experts suggest limiting caffeine to about 200 milligrams per day, which is roughly equivalent to one 12-ounce cup of coffee. It's always a good idea to discuss your caffeine intake with your doctor, but there's no need to completely give up your morning cup of joe. Switching to decaf or limiting other sources of caffeine, like chocolate or tea, can also help keep your intake in check. Many people also believe the myth that stress during pregnancy will harm the baby. While it's true that chronic severe stress can have negative effects, everyday stress is unlikely to harm your baby. Pregnancy can be a stressful time, and it's essential to find healthy ways to cope, such as practicing relaxation techniques, talking to a trusted friend, or seeking support from a counselor if needed. Managing stress not only benefits you, but also creates a healthier environment for your baby. Deep breathing exercises or mindfulness practices can be helpful tools. There's also a popular myth that you can't fly while pregnant. In reality, flying is generally safe for most pregnant women up until about 36 weeks of pregnancy. However, it's always best to check with your healthcare provider before planning any trips. Staying hydrated and moving around during the flight can help reduce the risk of blood clots. Airlines may have their own rules about flying while pregnant, so it's a good idea to check those as well. If you're traveling internationally, consider the availability of healthcare at your destination. Another myth is that you shouldn't dye your hair during pregnancy. Many women worry that the chemicals in hair dye might harm their baby. The good news is that most studies show that occasional use of hair dye is safe during pregnancy. If you're still concerned, you can opt for highlights or use natural dyes to minimize contact with your scalp. Always consult your doctor if you have any doubts. Wearing gloves and working in a well-ventilated area can provide extra reassurance. Have you ever heard that eating spicy food during pregnancy can cause labor to start? This myth is quite popular but not backed by science. Spicy foods might cause heartburn or discomfort, especially as the pregnancy progresses, but they won't trigger labor. If you enjoy spicy foods, there's no need to avoid them unless they cause you discomfort. Keeping antacids on hand can help manage any heartburn that arises. Some people believe that a baby's heart rate can predict its gender. According to this myth, a heart rate above 140 beats per minute means you're having a girl, while a lower heart rate means it's a boy. However, studies have shown that there is no correlation between a baby's heart rate and its gender. Heart rate can vary based on the baby's activity level and age, so it's not a reliable method for determining gender. Gender prediction remains one of the most intriguing parts of pregnancy for many families. A myth that can cause unnecessary worry is the idea that sleeping on your back will harm your baby. While it's true that sleeping on your side is generally recommended, especially in the later stages of pregnancy, sleeping on your back occasionally is unlikely to cause any harm. If you're concerned, placing a pillow under your back or hips can provide extra support and help you feel more comfortable. Listening to your body and adjusting your position as needed is the best approach. Another persistent myth is that pregnant women shouldn't eat fish. While it's true that certain types of fish with high mercury levels should be avoided, fish is an excellent source of omega-3 fatty acids, which are crucial for the baby's brain development. Safe options like salmon, sardines, and trout can be included in your diet. It's all about choosing the right kinds of fish and consuming them in moderation. Cooking fish thoroughly and avoiding raw options like sushi can also help ensure safety. You may have heard the old wives' tale that if you have heartburn during pregnancy, your baby will have a lot of hair. This myth has persisted for generations, and surprisingly, there's a small grain of truth to it. Some studies suggest a correlation between heartburn and a baby's hair growth, possibly due to pregnancy hormones relaxing the esophagus and also influencing hair growth. However, heartburn is primarily caused by hormonal changes and the pressure of the growing baby, so it's not a reliable predictor of how much hair your baby will have. Staying upright after meals and avoiding trigger foods can help alleviate heartburn. It's also commonly believed that pregnant women should avoid baths. Some people think that taking a bath might lead to infections or harm the baby. In reality, baths are safe as long as the water isn't too hot. Extremely hot water can raise your body temperature, which is not recommended during pregnancy. Warm baths can actually be very relaxing and help relieve aches and pains. Adding Epsom salts or essential oils with your doctor's approval can enhance the experience. A particularly confusing myth is that you can't get pregnant while breastfeeding. While breastfeeding can suppress ovulation to some extent, it is not a foolproof method of contraception. Many women have conceived while breastfeeding, so it's essential to use a reliable form of birth control if you're not planning another pregnancy. Discussing options with your doctor can help ensure you choose a method that works for your needs. Finally, there's the myth that pregnancy is the same for everyone. Every pregnancy is unique, and what works for one person may not work for another. Some women experience very few symptoms, while others might face challenges like severe morning sickness, gestational diabetes, or preeclampsia. The key is to listen to your body, follow your doctor's advice, and avoid comparing your experience to others. Building a strong support network can make a significant difference. Pregnancy is a time of joy, anticipation, and sometimes confusion. With so much information out there, it's easy to feel overwhelmed. By debunking these common myths, we can help expecting parents feel more confident and informed. Always remember to consult your healthcare provider if you have any questions or concerns. They are your best source of accurate information and support during this incredible journey. Pregnancy is a unique and personal experience, and understanding the facts can make it even more special.